Okay, good afternoon, everyone. This is Kendra Hirata from CityNet Yokohama Project Office. And welcome to our third series of the webinar hosted by Secretariat. This afternoon, we have three very distinguished speakers who will be talking on business continuity plans on business and employment, health sector, and the education sector. Just before we begin, let me make two announcements. For any kind of questions for the participants, you may use the chat function if you are using Zoom to send us the questions. And towards the end of the session, we will also send you the survey if you have not already received the link. And we would like to request you to complete and send it back to us as well. Now let us begin this afternoon's webinar. We are also joined by Dr. Jaganathan, who is our Secretary General, as well as our Special Advisor, Ms. Mary Jane Ortega. Our first speaker this afternoon is Honorable Mayor Jerry Trenãs of Iloilo City Government. Iloilo has been one of the most sought-after destinations for business and investors and tourists alike. From heritage sites and festivals to catering some of the best dishes in the country, the city has grown rapidly with a well-planned strategy. The city has also been known for its resilient practices and has managed the current COVID-19 crisis well. Mayor, could you please share with us how your strategies have worked out and what would be your roadmap from the current situation onwards? Mayor, the floor is yours.
Thank you, Kendra. Good afternoon to everyone. I will now proceed with the Iloilo experience during the COVID-19 situation. With a fast increasing number of COVID-19 cases in the Philippines, we created the COVID-19 team of Iloilo City and activated the 24/7 Operation Center manned by our City Disaster Risk Reduction Management Council members in February.
Next slide, please.
Next slide, please. As the entire country was placed under Code Red Sub-Level 2, we imposed an enhanced community quarantine in Iloilo City through Executive Order Number 55, effective March 20. All transport were suspended as well as all ports and borders of Iloilo City were declared closed. We also identified sources of budget for our COVID response initiatives and created the Iloilo City Compliance Team and deployed compliance officers to ensure adherence to all national and local issuances, including physical distancing and wearing of face masks. Next slide, please. We have implemented various assistance programs for all affected constituents. We distributed relief goods containing rice, canned goods, instant coffee, instant noodles, among others, to all households in the different barangays of the city. Next slide. Next slide, please. We have established the Uswag Kitchen Patrol, which served meals to our frontliners. We also established the 240 Uswag community kitchens in our 180 barangays, which served meals to all our residents. Next slide, please. We provided livelihood assistance such as cash for work, cash aid, and grocery packs to all members of our LGBT community who were affected by the lockdown, as well as cash assistance to our ambulant vendors who lost their sources of livelihood as we implemented the ECQ in Iloilo City. Next slide. Along with the Department of Labor and Employment, we identified displaced workers and provided them employment in the respective barangays through the Cash for Work program of DOLE. Next slide. Our city is one of the recipients of Social Amelioration Program of the national government through the Bayanihan We Heal as One Act. Next slide. We have issued regulation ordinances to extend the deadlines of our real property and business taxes. Also, the Department of Finance issued Department Circular to extend further the deadline of payment of taxes to June 25. We also approved an ordinance for a tax amnesty on all real property taxes which are declared delinquent as of December 31, 2019. Next slide. We created the ad hoc committee with a strong presence of private and business sector to prepare our ECQ exit plan. We identified priority industries with high economic relevance but low risk of transmission to be allowed to operate first as we transition from ECQ to GCQ to modified general community quarantine. Next slide. We also identified proposed additional incentives on top of our existing regulation ordinance or the investment incentive code of Iloilo City. Next slide. We have also prepared rehab and recovery plans, including the establishment of an isolation and quarantine facility, the establishment of our COVID laboratory and dormitory, the construction of storage facility for both food and non-food items, and we enjoined all telephone and cell phone companies to engage in massive infra development in preparation of the proposed online classes for our schools. Next slide. We have included livelihood possibilities and job opportunities for our citizens, coordinating with the DTI, the Department of Trade and Industry, to provide business financing and financial services to MSMEs. And we are very closely working hand in hand with the Department of Agriculture for the capacity development of food processing and preservation of our farmers and fisher folks. Tomorrow, next slide, we are initiating a meeting with all the governors and the mayors of highly urbanized cities in the region to synergize our plans and activities in jump-starting the economy of the region and to further strengthen our respective health capacities. We had a meeting with the Secretary Anyo of the Department of Interior and Local Government and Secretary Carlito Galvez through Zoom, and Secretary Galvez visited our city last June 2, and he lauded the COVID measures response mechanisms implemented by Region 6. We further collaborate with NEDA and other agri-economies in planning our economic directions to address our need for recovery. And at the moment, that is where Iloilo stands together with the whole region. And we are very happy with this webinar because we will be able to share at the same time, learn from the experiences of others. Tomorrow, as we meet the governors, we have requested financial institutions like Land Bank and DBP and the PPP Center to also present so that the governors will have an idea what are the available packages that they can use for their provinces. What we want to do right now is really come up with the is to push really the region for the governors to come up with programs and projects that will help jumpstart the whole of Region 6. And hopefully, while this is going to be a great task, we are going to start the first step. Thank you.
Thank you very much, Mayor, for your insights on your initiative. Now, let us go through all three speakers first, and then if there are questions, we will take them from our participants. Our next speaker is Dr. Ruwan Wijayamuni. He is the Chief Medical Officer of Health and the team leader of COVID-19 medical team of the city of Colombo. Dr. Wijayamuni, it seems like compared with other South Asian cities, Colombo has been doing fairly well, and this crisis is being contained now in your city. Could you please share with us how you did it and your exit strategy from now?
Okay. First of all, thank you very much for giving Colombo this opportunity. When we look at when this first COVID case struck Colombo, since then, as per today, Sri Lanka has 1,857 confirmed COVID cases, and the city of Colombo had its last case on the 1st of May this year. So it's about nearly 40 days since we didn't have a single case, active case within the city. So this, when you look at the entire case load, is about 7%, little less than 7% of the entire country. So, I think that's a remarkable achievement for the city. Next slide, please. Because how we achieved that, I think from the very beginning, the city administration. Next slide, please. The city administration with the mayor of Colombo, her worship, and the municipal commissioners, we got together and we started designing on an emergency preparedness plan and also a response with a very clear vision and goals and strategies at the beginning of March. Next slide, please. So we had a very good, from the very beginning, we had a very good emergency preparedness and response plan with a very clear vision, goal, and a strategy. Next slide, please. Yeah, so our vision was to keep the city free of COVID-19 patients, I think, which we have achieved when we look back 40 days ago. It may be a little too early to comment on it, but nevertheless, that we have achieved. So our main goal was to intervene proactively to prevent COVID-19 outbreak within the city, and more than anything, and not to allow it to develop into epidemic proportions, and also to prevent its. Can you hear me now? Yeah, okay. Can you hear me?
Yes, please continue.
Okay, right. Okay. The more than anything, to prevent its community transmission and to contain the disease within the city limits of Colombo until its final eradication, because we have seen what has happened in other cities. When the city fall into COVID, then that spreads within the entire country within a very short span. So we thought that we should try to contain it within the city, whatever the cases that that comes. Next slide, please. Yeah. So when we look at the entire the COVID control plan, we thought that there are certain essential components that we need. So as I said, the emergency preparedness and response plan, establishment of proper channels, which we didn't have earlier, or links. Then enhancing technical capacities and stockpiling, and risk communication to the public and public engagement, and also enforcement of very stern public health measures based on epidemiological data and its analysis, and also the dissemination of that data for the policymakers to make proper decisions on time. Then mechanism for incident and case management at the community level, and of course that testing, tracing, quarantine, lockdown if necessary, and of course, island-wide and quarantine curfew. We call it the quarantine curfew, which have been imposed in Sri Lanka for the very first time. We have had curfews, but quarantine curfew was imposed during this COVID-19, which have been very, very successful. Next, please. Yeah, so we have certain success outcomes to share with, and I think our very early and compulsory hospitalization of all COVID patients, irrespective of whether they were asymptomatic, whether they had symptoms or no symptoms, um, or whether they had or no symptoms, it was unique that we decided, okay, they should be hospitalized in COVID treatment specialized tertiary care units. And right, so the entire country had only 11 cases, and the city had 2 deaths. And also, we made it mandatory the self and home quarantine for all first and second contacts, and their quarantine at designated central quarantine centers. I think this was something unique where the country had embarked on central quarantine units, centers, and people were taken there in order to spread, in order to curb the spread of the disease within the city. And next, please. Yeah. So then also we had a very vigorous COVID-19 surveillance system, and you can see, and also the public health measures were taken based on that. Next, please. Next slide, please. Yeah, okay. So you can see at the beginning, from the 12th of March, we had, one or two cases. Third days, we didn't have a single case. But on the 17th, on the rather 19th of April, we had the case number 21, where we felt that, that particular case we diagnosed, and then we started vigorously checking and testing all the neighbors, and also who were the people who were in contact with them. So what we found was within 36 hours, we got 31 cases from a community. And to see that, in fact, the community transmission has started. If we have failed to detect that, it would have been within just 3 weeks, we would have got 6,000 cases out of that 93 cases which we got from the vicinity. So this was something, very unique, where our rapid detection system worked very well and is paid off. Next, please. Yeah, so I think city COVID control strategy was planned with the Ministry of Health officials, epidemiologists, our doctors from the very beginning. Next slide. Yeah, so we'll go through fast. Field visits so for case handling, my doctors and public health inspectors. Then even at nights, we were on the field, dispatching patients to hospitals. So did all that. Then contact tracing, inspecting the surrounding houses. Next, please. Yeah, dispatching them to the hospitals. Yeah, next. Disinfection of the houses of patients and contacts. Then rapid PCR testing and antibody testing in the field, which we wanted to find out whether there's a community transmission, which we found is not so right now. So really good. Yeah. Next, please. Yeah. So now I think we have come to a stage, as I said, within the country, we have now only imported cases where people who are coming from other countries, our expatriates who have been working in the Middle East and we're in the Europe, and they come infected. And so now we have planned, the entire country had planned for a very very clear exit strategy, and of course the city as well. Next, please. Next slide, please. Yeah, okay. Next slide. Yeah, okay. So when we planned our exit strategy, we know that it's global and local emergency, and it's a pandemic. So future waves are inevitable. It might be there. So we have to be prepared for that. Then having that in mind, we have prepared a very clear exit, or rather restoration plan. Next, please. Yeah. So what's next? Basically, yeah. I think we have to maintain social and physical distancing, and we have to keep on doing testing, PCR testing and antibody testing with the help of the academia. Then we have to continue with house quarantine and disease surveillance among imported cases, because what's happening when a case comes, when a patient lands, rather when a passenger lands in our airport, so their PCR test is done. If it becomes positive, then they are sent to the hospital, and they are kept there for 2 weeks, and then they come back. And we have to do another further health surveillance of 2 weeks. And so we have to continue with our excellent contact tracing and containment measures. And of course, we have to continue with the public awareness, hand hygiene, physical distancing, etc. And also the timely referral to contacts and suspected cases for tertiary care units. So, yeah, next slide, please. So the city is very much determined to continue with all the functions through already built infrastructure and system for COVID containment that we have in place. Then a very clear roadmap for Colombo economic activity restoration in place. Also, the government also has um, uh, come out with a timeline for resumption, if you can see, right? So it very clearly says what should be restricted, what should be allowed, so on and so forth. Um, and for example, all the government and private offices are functioning now. Certain places in full capacity, certain places 50%. And for example, hotels, restaurants, we have allowed, first we allowed restaurants and eateries to have only online orders and deliver food. Then we allowed, we went step by step. Then we allowed them to what you call uh, 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 take up orders, and takeaways were allowed. But now dining in was allowed, and they can of course the seating capacity had to be reduced to less than 50%. Then the beauty parlors, very strict guidelines were given for the beauty parlors and salons. Then factories, the garment factories and other factories have started with 50% or sometimes 60% capacity. And the construction sites, which is very, very important for the city, because the construction industry was booming just before the COVID. And so the construction industry, we personally inspect these sites and give our recommendations. We started with 1/3 workforce, then we went up to 50%, and in certain places now 100%, but they have to keep the physical distancing, hand hygiene, all that had to be there. Then tourism is very, very important for our country, and there is a presidential task force on COVID control, and that presidential task force has proposed to open airports in Sri Lanka by 1st of August, and country is gradually getting ready for that. And also, when we look at the other sectors especially what will happen when tourists come to Sri Lanka, for example, he or she has to get COVID-19, the PCR test within 72 hours. He embarked on, he gets into the airplane, and if not, his test will be done at the airport, and they will be placed in a hotel, nearby hotel, until the results are available. If negative, they can proceed, and if positive, then they should be what you call basically hospitalized for 2 weeks, and released after 2 weeks. Um, because then their travel restrictions will be imposed on them. When you look at the other things like the weddings are allowed, now with the capacity of less than 100 guests. Then funerals and all the gatherings are highly discouraged. Then uh, uh, religious activities and basically religious activities and other gatherings are also restricted. Um, and we will be checking, my team will be checking on all those activities, and uh, uh, we will be moving very clearly in accordance with the government guidelines given to the city, and city activities, the other activities like the libraries, parks, they have started working now. So we can see now city is coming back to its normal life. Thank you.
Thank you very much, Dr. Ruwan, for sharing Colombo's initiatives. Now, before we go to question and answers, we have our Secretary General, Dr. Jaganathan, who will give comments regarding the three presentations that we just heard. Dr. Vijay, yes.
Thank you very much. And let me first start by congratulating our three speakers for excellent and inspiring presentations. For us in CityNet, what is particularly heartening is to see how well some of our members are doing. And I think both Mayor Trenãs and Dr. Ruwan laid out very clearly the number of steps which were taken, which exhibits true leadership on the part of the city level. So Mayor, my congratulations to you, and I'm sure you will be an inspiration for many of our other city members who have not been so fortunate in tackling this terrible pandemic, which is affecting all of us. So congratulations, and from behalf of CityNet Secretariat, what I'd like to offer is to see how we can use your experience to really showcase the good examples, the training modules, so that others can benefit, and also pass on the message saying that good practices come not only from Seoul and Yokohama, they also come from our cities across the network, whether it's Philippines or Sri Lanka or Nepal or Vietnam or any other country. So congratulations once again. Now, leadership is obviously very important, but along with that, what was very clear in all the presentations was the importance of careful planning. And we know that in the case of Iloilo, there's been this long tradition of excellent management of disaster risk. If I remember right, even when Typhoon Haiyan hit the Visayas very badly, your city was saved partly because of careful planning. But more than that, I think what was very interesting for me was the way you had incorporated the poor in your business continuity plan. What we are seeing in many countries is that some of the very poorest of the poor, the street vendors, for example, who get all their livelihood sitting out on the streets and sidewalk, are the worst affected by a pandemic and by social distancing as an order. And so there, the fact that the city had the care to really plan for these people, not only them, but you also mentioned about other minorities like LGBT and so on, it speaks volumes to the way in which the leadership is being managed in the city. So congratulations again. Now, as far as Sri Lanka was concerned, it's really impressive what you did in terms of your surveillance. And it's just incredible how you've been able to keep the rates so low, particularly as Colombo's gateway for the country. And as we've seen in all the countries of Asia, mostly the COVID has come through the airports by passengers coming either from Middle East or Europe or China or wherever. So this is again a testament to the strength of the institutions. And so from our side, from CityNet side, both the Iloilo and Colombo cases, just like we have earlier done in the case of Seoul also, are really worthwhile showcasing to our members and even to the global community as an example of good practice and done without too much of more costs than what was really necessary. Now, the other point also, which I think is very important here, is that both of you in your presentation made it very clear that the effort is not just of the city, but in partnership with other levels of government. And I think that is one of the key factors about a disaster, whether it's a natural disaster or a health disaster. No one can do this on their own. Nothing is achieved by pointing finger at someone else for not doing the job. It's really about cooperation, collaboration, and working across political divisions or personalities and so on to deliver the result. So that's a very important message, which also sometimes gets lost out. And the third point, which I thought was also made by Dr. J. Rajasekhara from Tokyo, is that today we have this benefit because of the digital revolution to get a lot of ways in which we can get communities together, get them to communicate, get them to learn, change, in fact, without disrupting someone's university life, to make sure that they graduate in time and so on. So this is a great benefit. And one of the things which we would like to do on the part of CityNet, we are trying to work on this, is to see how the digital data can be used by leaders in the city to really achieve not only in terms of managing their disasters, but for the business continuity part. And again, there, Mayor Trenãs made this point about how they're taking efforts to see that that Iloilo city, which has had a very good record of outsourcing and being a business outsourcing center, that it doesn't get its work disrupted by leadership at the city level. So all in all, I personally learned a lot. I'm sure our other members also will learn a great deal. We also want to give a few minutes for any questions which may be coming from those who are participating. So thanks once again, and over to you, Kendra.
Thank you very much, Dr. Vijay Jaganathan. So before we get our questions from our viewers, I think some of them are still typing. I have one question for Dr. Ruwan. Thinking and planning ahead, what is your plan for public awareness activities to continue? How are you going to do that, and what should the public be aware for the coming months? I think your mic is muted still. Okay, now it's okay. Yes. Can you hear me? Yes. Yes, please. Okay. I think it's a very it's a million dollar question. So because this is what we should be doing right now, because more and more because a lot of people think, okay, the COVID is over, well, we are now safe, but it's not so. I mean, we have to keep on telling them, reminding them the danger is not yet over. There can be second waves or whatever. So it's very, very important that they keep that in back of their mind. So the awareness is twofold: at local level, at the city level, and also at the government level. So there are lots and lots of electronic media awareness was in place, and it's still continuing at the government level, and also the printed media we are using quite extensively. So the government is doing their part. There is a health promotion bureau from the health perspective, the health ministry. Then, of course, various other ministries when it comes to, we'll say, transportation. So they keep on telling and reminding people about the social and the physical distancing, the importance of wearing the mask, hand hygiene, then using sanitizers, all that. Then also, when it comes to the city, we use our own methodology. We have our health education unit. So we are using that particular unit to reach especially the low-income settlements of the city, which is nearly about 45%. So we have a special program for them. We use posters, leaflets. Then also we have our public address system that we are using. And also at the district level, the education of community leaders, and we are trying to disseminate that information through them. And also in the meantime,
my staff is going to various work settings, whether it's government or private, for educating and making people aware.
Thank you very much, Dr. Ruwan. For our viewers' information, the mayor of Iloilo, he had to leave because he is attending another webinar currently. We also have our special advisor, Ms. Mary Jane Ortega, with us this afternoon. Mary Jane, do you have any comments or questions regarding the presentations? Mary Jane, I think your mic is on mute.
Okay. I would like to congratulate, as Vijay has congratulated all our three speakers. I would just like to add, I agree with whatever Vijay said, but I would just like to add, because I've known Mayor Trenãs since he joined the CityNet, we were at CityNet together. And I would like to say that with CityNet, CityNet should be very proud of both Iloilo and Colombo. They are the perfect examples of the vision of CityNet way back in 1987 when it was organized. It could already foresee that they needed to have local officials to be capacitated, to have good governance, and this is the example that we can see. And one thing with Colombo, with Dr. J, and also with Mayor Trenãs, they have succeeded this because of the very good networking of their cities under their leadership. They have learned good governance. They have gone into multi-sectoral governance council. They have gone into this leadership pathway because they have networked with each other. They have seen good models, and they are now the models. And I wish that they could reach out, as you know, Mayor Trenãs used to be president of the League of Cities of the Philippines. He is now showing his leadership in Region 6. I hope he should now be more active also in the League of Cities and also municipalities to show the way to the other local officials. To Dr. J, I would like to say that I agree. We hope that for college and postgraduate students, the answer could be the online education. But the problem is with the lower classes, with basic education. You know, children from the very young age should also learn how to socialize. How can you now be a social human being if you grow up just communicating through the computer? We don't want to have robots growing up if they're already grown-ups. Yes, but this is where you really need face-to-face education. And perhaps we now have to go back again to home education or to the community leaders education. And this is where data is needed to find out who are the people in the community who can provide this while at the same time observe social distancing. For Dr. Ruwan in Colombo, congratulations, Dr. Ruwan. Are you a member of the Healthy Cities of the WHO? I can see that you are so confident in the way you approach the problem of COVID. And in fact, I wondered, did you have also an experience with MERS and SARS like Seoul, so that you approach this problem of COVID with the experience from the past? But before this, I also came up with a question. I know that Colombo and the city of Iloilo have been partners of the city of Yokohama with CityNet on disaster preparedness. Although the emphasis, as Dr. J mentioned, is more on earthquakes and natural disasters. Was this training, capacitation on disaster preparedness able to help them cope with a disaster of a pandemic like COVID? So these are the things that have come up to my mind, but I'm so glad and so proud that we have leaders like Mayor Trenãs, and you have the leaders in Colombo, and the leaders in health, and leaders also in education. So Dr. J, aren't you very proud of Sri Lanka? So with that, congratulations.
Okay, thank you very much, Mary Jane, for your insights as well as advice into what our cities and our members can be doing in the days to come. We are almost out of time for this afternoon's webinar. If we do receive more questions by email, we'll be able to forward it to our speakers for your response. And just as a final reminder, we will also be sending the evaluation form as soon as you close this window, which you may submit and present. Now, once again, thank you very much for Mayor Trenãs, Dr. Ruwan, and Dr. J for your time in presenting your initiatives for CityNet's third webinar series. And also thank you very much, our Secretary General, Dr. Jaganathan, and Ms. Mary Jane Ortega for your comments. Thank you, and we hope you will join us in the next webinar.
Thank you so much. Thank you so much, Kendra.
Thank you.